Okay everybody, here we go. I'm going to do my first video. I'm actually going to do two videos. One about the puppy folder and then one last minute tips for advice. That way you don't have to watch one whole long one to get the information that you need in case you need to rewatch something. So I have a folder here for everybody. This one is Hawks. In the folder you're going to find a little baggie. This has your dog's microchip in there. It's not microchip, microchip tag, identification tag, and then some stickers that can go on paperwork for the vet clinic and whatever other paperwork you need it for. Those will be in there. So they do have their microchips inserted already. They will have a vaccine protocol sheet, which we'll go over in a second. They will have an exam sheet from their vet visit. They will have AKC paperwork. If you would like to register your dog with AKC, you can. You certainly do not have to. It's completely up to you. You will have a copy of the commitment to your Bernese Mountain Dog that I had you guys print out at home. You signed a copy that you'll drop off to me, and I have signed this copy so that you have one as well. And then we have the health guarantee, same thing. You guys will be printing this off and handing it in to me. And in your folder, I have signed yours, and it's going to go home with you. So that way we all have signed paperwork. That is on the first side. And on the second side, there is an attachment with my business card on the pocket. Then this sheet here is basically what the puppy's pedigree would look like. The dad's on the top and the mom's on the bottom, and all the red dogs are champions. Not that it really matters to anybody, but that just gives you all the information of their bloodlines if you were to purchase a pedigree. This article here talks about umbilical hernias. They're quite common in our breed, and there's nothing to be concerned of. They're just an umbilical hernia. Some of the puppies have them. Hawk, actually, I think Hawk was the one that had one in Mabel's litter, and I think there's quite a few in Lotus's litter. But the vets check the size and make sure that there's, nothing to be concerned with. And never had an issue, had a lot of hernias, never had any issue come about with them. But that just gives you some information on hernias. There is a sheet regarding bloat. This is a pretty serious thing with large breed dogs that you need to be aware of. I've never had it happen in our dogs. I've never known any burner it's happened to, but because we fall in the large dog category, it's definitely something to know about and know what to watch for the signs. I have, let's see, these might be a little bit out of order. My son was helping me with them. Oh, no, this is fine. This is an Embark worksheet. It just kind of challenges you to work on socialization with your dogs, getting them out and about, meeting other people, experiencing new things. So it's just kind of a worksheet to keep track of what you are doing and how many adventures you guys have shared together as the weeks go on. This is an article regarding spay and neuter. It will talk about why it's better for the large breed dogs to wait until they're closer to a year or a little older. My contract states 9 months or older, and I would really like it if you can try to make it to a year. It's better for their joints, less incident of hip and elbow dysplasia, and also less incident of cancer. So here's an article regarding the risks of dog parks. This is something I want you to take very seriously. I know a lot of people think that dog parks are the best new thing, but if you ask any professional that knows a lot about dogs or experiences dogs on a daily basis, like myself as a groomer or a vet tech or a veterinarian, a lot of people have some pretty bad things to tell you about all of the diseases that can be shared unwillingly at the dog park, all the injuries that happen because dogs and owners are not behaving at the dog park. They shouldn't be at the dog park. So just be mindful. If you do choose to bring your dog to the dog park, I wouldn't let them get out of your sight. Also, it's really hard to know what they're sniffing and what they're eating and picking up, as far as, anything on the ground could get them sick. So, the other thing, what was I going to say about dog parks? Oh, if you do decide you do want to go to a dog park or any place like that that is, highly traffic area with dogs, you do want to be mindful. You want to wait until the puppies have had their full series of distemper parvo vaccines. So that means 3. You could do it at 2. I recommend. I'm pretty anal with my dogs. I don't want to risk anything. I've had one of my dogs had parvo before, and it is no fun. That was Mabel, and it was a terrifying time. It cost me thousands of dollars to save her life, and it was the worst nightmare anybody would ever want to go through. So I don't take that risk. I wait till the 3rd distemper shot. I'm also doing that with my puppies regularly as far as dog training class goes too. Totally up to you. I know a lot of people do it after the 2nd vaccine and they're just fine, but I don't risk it, and that is your call. So the next article I have in here talks about joint care. This just talks about the things you want to avoid when your dog is growing so rapidly like this breed does. You're going to want to avoid rough play with older and heavier dogs. You want to avoid constant stair climbing. You'll want to be carrying your puppy up and down the stairs as much as you possibly can until they get way too heavy, obviously. I don't expect you to be toting a 60-pound puppy up and down the stairs, but just try to keep them off it, from repeatedly going up and down and up and down. Some light stair climbing is good exercise and it's good muscle building, but it's not something you want to continually do up and down, up and down. And plus, they're very clumsy and you don't want any accidents to happen. Slippery floors are a huge risk for injuring your pet or hurting their joints, messing up their joints when they're young. So if they're playing rough and rip-roaring around, make sure they've got good footing underneath them, such as a rug or being outside in the grass, something with texture. If they're sliding across hardwood floors or tile, that is not what you want to be seeing. Another thing that can really damage the joints is overfeeding and overexercising. So those are the things you want to be mindful of. But I will say, a lot of people forget that as their puppies grow, they're going to need to increase their food. So I do get a lot of calls wondering why the puppies like trying to ingest everything they can possibly find and why they're eating tons of grass and wood chips and everything else. You need to watch for signs that your puppy is hungry. So if you have fed your puppy in the morning and it is sass barking, really wild and trying to, tell you off, more than likely they're actually trying to tell you that they're still hungry. They need more food. Other things to look for is, like I said, picking up, trying to ingest things that are not appropriate, like constantly. They just seem like they're starving. You got to increase the food as the puppies increase, in size. So keep mind of that and just keep having your vet check to make sure they're not getting too overweight as they're growing. We want them to stay a nice clean weight until they're a year. A lot of pressure on these joints as they grow. So the hip and joint formula that I've recommended is a huge help with these growing puppies. And if you do experience any sort of limping or lameness, just maybe played too hard or going through some growing pains, just make sure to increase the amount of hip and joint you're giving for a few days. So I recommend just putting a tiny pinhole in the top of the hip and joint bottle in the seal and just squirting a little bit on the food every day, just a small maintenance dose. The dose that they recommend on the bottle is way too high. It's like 2 tablespoons for a full grown adult dog, 80 to 100 pounds, I think it is like 2 tablespoons, and they don't need that much. I've actually talked to the rep about that. That's about enough to dose a horse. So, but by all means, if you're having lameness or issues like that, you're going to want to increase that up to probably a tablespoon or 2 for a few days or maybe even a week. To help them get through that time. So, and I'm always here for questions if something's going on, so just let me know. My last article, it talks about when it's really hot, what to look for as far as heat exhaustion, what to do, how to cool down a dog without doing it too quickly. Those are all things I want you to really, these are articles I really think are important for a Bernese Mountain Dog owner to, have and familiarize themselves with, and just be prepared. And yeah, so that's what's in your folder. All those articles are self-explanatory. The one I'm getting the most questions on, which I totally understand because it is very confusing, is the vaccine protocol sheet. And so normally I do our vaccinations around 7 weeks of age. A lot of people end up picking up their puppy for some reason at 7 weeks or 7.5 weeks, just depending on, when is convenient for them. So this time, everybody's picking up so close to 8 weeks. I'm going to do the vaccination either a day before 8 weeks, or Lotus's litter will be actually on 8 weeks. So we're just going to call it 8 weeks. We did the vaccine at 8 weeks old. On this sheet, there will be a sticker. I haven't done it yet because we haven't done the vaccine yet, but it'll have the exact vaccine label that we used for your puppy and the date it was given. And then below that is going to be the worming schedule that we use. So it'll tell you all the dates that we wormed, what kind of wormer we used, and the thing I wanted to talk about too is that the puppies with their fecal exam. Hold on, I have to tell my daughter to be quiet. Okay. So, all right. So we did the fecal examination like we do before any puppy visit, and the puppies were positive for coccidia. So that is a parasite, and we are treating all the puppies for it. The last treatment for Mabel's litter is going to be due on Sunday, the day that they go home. So we'll be giving you medicine for that last dose. So they are on Albon 5 days for the coccidia, so that should treat that. I will be posting an article so that you guys know what to do as far as coccidia is concerned. You're going to want to keep an eye on it. You're going to want to make sure that they end up testing another fecal to make sure that it's all cleared out, and that you're not going to have any trouble with it. Beyond this, it's very common with puppies because they're putting everything in their mouth, and really the only way to try to really nail it down and avoid it is to never let them go outside, because that's usually when they pick it up. But there's so much enrichment and things to be done and explored and experienced outside that I think that would be a real terrible thing to do to keep puppies from being outside. So I choose to take that risk, and we've had it before in the past and we treat it, and it is what it is. It's just one of those things that comes with puppies, just like worms or Giardia or anything else that they can pick up, because they're sticking everything in their mouth. So I will, like I said, post an article on that, so there's more clarification as to what coccidia is and what the treatment is, and just what to be looking for when you're home. The biggest thing is just I want everybody to get in a good habit, especially right now for them when they're out potty training their puppy, picking up every stool. It's important to pick up every stool, especially right now when they're little, because they could be passing worms or eggs or whatever from all their deworming that they've been going through, and the coccidia and all that. If you're cleaning up after your pet like you should be every time, especially during this first stages of potty training, because you're out there anyways praising them and everything else, there's less likely for them to get reinfected with anything. And also, you're going to eliminate the habit of them trying to eat their own poop, because they watch mom do it, and it's a very normal habit for them to pick up from mom. And as much as we try to eliminate that by picking up 1,000,000 times a day, trust me, we have like a poop picking up schedule here. We're out there constantly. So, but yeah, they do it. And this is the age where it starts for some reason, and this is how sometimes we get coccidia too, because they're snatching it up before we get it. So yeah, so that's disgusting, but that is the true deal when it comes to puppies. The other thing I wanted to talk to you about, back to this page, is the vaccine schedule. There's some references in purple. These are some references to kind of familiarize yourself with why we vaccinate the way we do. some good reading for yourself. I know a lot of people will get to their vet clinic and they feel kind of bullied into doing what the vets want them to do. And so sometimes if you read a few of the articles, you'll feel like you have a better understanding and a better, place to push forward with what you're looking for and how you want to vaccinate. So this confusing schedule. All right, so since we didn't start at 8 weeks of age, or since we didn't start at 7 weeks of age, we changed this 9 to 10 week vaccine to 8 weeks, okay? We want to be vaccinating every 3 to 4 weeks. Nothing closer than that, because that's overloading their body. We need their immune systems to build back up in order for them to be able to tolerate the next vaccine. So then we're going to go 4 weeks later to 12 weeks instead of the 14 to 15 weeks. We're going to get a distemper and parvo again at 12 weeks. And then we're going to sneak one in at 15 weeks, which is 3 weeks later. I'm telling you that because I've been hassled a little bit over in the past about not doing enough distemper vaccines. So if they want that extra one in there, I'll put the 15-week one in there. Then we'll go to 18 weeks for a parvo only. Then we're going to go we're going to go an extra week so we can space it out again for the rabies. So we're going to go 21 weeks of age for the rabies, and then you're going to follow up at a year. And when they say a year old, I'm assuming, and I'm pretty sure, but you may want to check with your vet, that would be a year from the first vaccine. So double check that with your vet, and I'm cool with whatever they recommend as far as that goes. But a year old for distemper and parvo, and then a year old for rabies vaccine, I guess, vaccine follow-up, whatever you want to call it. After this year vaccination for distemper parvo, that is up to you what you'd like to do. You should be able to do it every 3 years, but there's been a lot of research and studies showing that these parvo and distemper vaccines are effective for 8 to 15 years, and that's far past what we need them to be. So I personally choose to not vaccinate after that year mark. What I do instead is called a titer test. It's a blood test. I do it every 3 years or so. And basically what that does is run the blood to make sure that your dog is still holding immunity against parvo and distemper. So without giving them a vaccine, it's checking on them to make sure that if they were exposed, they're still immune and they can still handle it. So rabies is a different story. We have to stay on a rabies schedule every 3 years by law. So that is something that you don't want to mess around with. You need to keep updated, because if your dog were to bite somebody or were be accused of biting somebody, that could cause you a lot of problems down the road. So always stay up to date on that rabies vaccine. Should be this 1 year booster, and then it should be a 3 year thing every 3 years after that. So basically my main concern is these top ones. I don't want anybody vet talking them into Bordetella. Oh gosh, there's so many other stupid vaccines that are not worth it. Bordetella is a big one. Lepto is a big one. Lyme's is one of those things that I will allow leeway on, but I really want you to think, if I have a whole article I can send you, it's many pages long, that it really explains, how Lyme's works, how the vaccine does or doesn't really work. It's more of a sense of security for everybody, but it's not going to prevent the disease. It is high risk for reactions. And basically what I'm trying to do is keep any unnecessary toxins, from getting into these puppies if possible. So at the end of the day, these are your puppies. Yes, I say that my vaccine protocol needs to be followed, or your contract is null and void. I really want you to take a stand and think about these things and really consider minimal vaccines. If you just decide to do Lyme's, let's have a conversation first. I'd like you to know more about it. I'd like you to read the article. But if you're in a high risk area, absolutely we want to have your puppy protected. Same with Lyme, or not Lyme's. Same with flea and tick preventative. I would love it to be natural, but if you're up in the woods and you're getting tons and tons of ticks, yes, we have to go a step above and use something stronger. So I am willing to work with you. I know everybody's situation is different. So if you have to go against the protocol, let's have a discussion and just make sure that it's necessary. Alrighty, so that wraps up that. And then I'm going to do a separate video on some of tips for bringing home your puppies that hopefully will be helpful. Thanks.